This is a presentation on Code of Ethics. Within the Nursing Code of Ethics, there are 9 provisions. Each provision states a framework to which a nurse abides within their practice. Provision 9 involves assertion of values, power and value structures, social justice, and health policy. It may look something like this. The night shift is giving report. Patient is a 43-year-old female who arrived at 0400 with complaints of lower abdominal pain, burning with urination, and yellow vaginal discharge. I collected vaginal and urine samples, and they were sent to the lab, and it came back positive for chlamydia about 10 minutes ago. I informed the patient of their test results. She came back very reserved. I told the patient she was free to leave to pick up her antibiotics, but she just didn't want to leave her room. I am not sure why her behavior has changed drastically, and I explained to her that chlamydia is very treatable. Maybe you can speak with her one more time and wrap this up quickly so we can get to the next patient. Okay, I will speak with her again and do a quick assessment. Thank you for the update. No problem. I'm out of here for the next 5 days. This is all yours now. Good luck. Hi, Mrs. Smith. I am your nurse, Kelly. Can I come in? Yeah. How are you doing, Mrs. Smith?
Not that great. I can't believe I have chlamydia.
How many partners do you have?
Just one, my husband Tom, but we had not had sex in a long time until last week.
Tell me more about that.
He came home very drunk that night and forced me to have sex with him. I try to avoid him when he comes home drunk.
Do you feel comfortable telling me more about that night?
My husband has trouble keeping it up and gets more frustrated about that when he is drunk. He grabbed me and forced me onto the bed. I couldn't do anything, so I just lay there.
Would you like to talk to our specialist about this further?
I don't know if I want to report him. I don't know what to do.
Do you want to speak to someone and go over your options?
Okay, I guess I can. I just don't want to go home right now.
The day shift nurse then went to the social worker and explained the situation. Stop and think about this for a second. What would happen if the nurse didn't inquire further into the situation? What if there are others with similar incidents and the nurses could not investigate the real stories behind these patients? The day shift nurse saw that this is her responsibility to make sure her facility staff receives better training on how to handle sexual assault cases and the possible signs of sexual assault. The day shift nurse recognizes that she doesn't know much about this topic but doesn't want a patient like this, one to be missed like she almost was. The day shift nurse joined Washington State Nurses Association and helped advocate for increased access to training for those who want to become sexual assault nurse examiners or increase their training on their basics of recognizing and helping those who have been sexually assaulted. She tried to advocate for a uniform and community-based response towards sexual assault victims to ensure they receive adequate care in a timely manner.